name's George from Vivid Care, Sales Director here, and what I'm showing you today is our brand new HiBack Bedside Chair. So this is typically found in the hospital environment beside a bed, and we've looked at, for quite some time now, redesigning the whole concept. We're getting multiple feedback in terms of patients not wanting to sit out in chairs, finding it uncomfortable. Patients were sliding out of chairs. They didn't work particularly well with transferring from a chair to a moving and handling aid. They were often not very adjustable and difficult to maneuver. So the first point I want to particularly highlight on is how easy this chair is to adjust in height. So for your different heights of patients, what you've got at the back of the chair here is a little fold out winding handle. And if I turn this anti-clockwise, this allows me to adjust the height of the chair, so bringing the whole chair up. And then if I wind that clockwise, we can take the chair all the way back down again. So that's adjustable from as little as 16 inches for somebody who's shorter in height, right the way up to 22 inches. Notice that I manoeuvre this using the handles at the back and the housekeeping wheels down below, so nice and easy to manoeuvre. Your next feature, which is particularly important with this type of chair, is that the armrests are removable or drop down or flip back. In this case, they're flip back, so we have a little pull pin and we can fold the arm right the way out the way. So if somebody's doing a lateral transfer, so transferring sideways, or you need to get access as a professional to place a sling in or a slide sheet, you can do that really easily. So it folds down, you pull the pull pin again, and that will allow it to click and lock in position. Next is that all the upholstery on the chair, so i.e. the arm pads, the seat cushion and the back cushion, are all really easily manoeuvrable. So you can twist the little toggle clips at the back, and that allows you to remove the backrest and the seat cushion. So for cleaning, this is really easy to get in here. And if required, we can replace just these individual parts. So if we compare it with what we have at present, most chairs have fixed upholstery. So if it gets damaged, you have to remove your asset. So the same goes for the seat cushion. Two little toggle clips at the back, and that allows you to remove the cushion again for cleaning or replacement. You notice that on the seat cushion, there's a few extra little receivers, and that's 2 seat depth adjustment markers. So this one here is 19.5 inch, and then here is 21 inches for somebody who's taller. So again, another adjustment on the chair for your different heights and weights of users. Now, in terms of the actual frame itself on the chair, this is made out of an antimicrobial polypropylene. So in short, that's a recycled plastic which is antimicrobial all the way throughout. So if you get any dints or scratches or damage to the frame, you're not showing a raw surface like you would be on a wooden or a metal frame of chair. So with it being antimicrobial all the way throughout, it's great from an infection control perspective. Lastly, I just want to show its compatibility with the moving and handling aids. So that is where somebody needs assistance from the sit to stand. And typically you use one of 2 devices in a hospital. So one would be a platform such as a return, which, as you'll see, because of the cutout at the front of the chair, you can get that really close in for ease for the patient for getting up and down. So that works particularly well, and also does the Sara Steady or equivalent. So in this case, we'll splay the legs out to its widest, and again we can bring this in and get that nice and close, even with the armrest down. So of course, if we flip both armrests back, we can get this now really close and right the way in for a patient to transfer in and out. So it's important that when considering something like a chair, we look at what other equipment we use along with it. So I'm just going to talk you through the pressure relief qualities within this chair. The armrests, the backrest and the seat cushion are all upholstered in what we call a Dartex material, which is very similar to what patients have on their mattresses. So it's a stretch material, so you get a lot better immersion into the chair. On top of which, you've got a foam called Levitex in the seat cushion, which is a medium to high risk grade pressure relief foam suitable for your category 2 or category 3 patients. Levitex has got similar properties from a comfort perspective to the likes of a memory foam, but it also responds a lot faster, so it doesn't bottom out and you get a lot more support when sitting in the chair. You've also got comfort built into the backrest as well as a lumbar support area, and then you've got some padding here in the armrests of the chair, which if you've got patients with very frail and thin skin, that takes away the risk of any pressure damage in that area. So should you have any other questions unanswered, want some more details on the chair, please get in touch with us. You'll see the information below this video. Just simply click on there and we'll be straight back in touch.